Peter.
Okay then, if we'd like to begin, I will now open the fourth panel of the day. Firstly, to introduce myself, I'm Rhys Hart. I'm the chair of the Youth Select Committee, and a big thank you for coming and attending today. We know you're very busy and you have lots to do, so we're very grateful for the time you're giving us. If you could introduce yourself, please, and just say a few words about the organisation you're representing, it'd be more than helpful. Thank you.
So I'm Dr. Martin McShane. I work in the Medical Directorate at NHS England. I'm the Medical Director for Long-Term Conditions. And NHS England is charged with commissioning services, specialised services in primary care, and supporting and assuring the role of clinical commissioning groups which commission community and other services, the bulk of services in local communities. And we work in partnership with other, what we call ALBs, arm's length bodies, so Public Health England Monitor, the Trust Development Authority, see if I can remember them all, CQC, the Care Quality Commission, and other supporting organisations like NICE and the Royal Colleges. I hope that's sufficient.
That's great, thank you.
My name is Leanne Walker and I work for GIFT, which is Great Involvement Future Thinking, and I'm a young sessional worker, and GIFT was commissioned by NHS England to support participation, so getting young people's voices heard on a national and local level.
Thank you.
My name is Peter Fonagy. I am a Professor of Clinical Psychology at University College London. I am also National Clinical Advisor for Children and Young People's Improved Access to Psychological Therapies, which is a program of service transformation that is been going since 2011 to try and improve the quality of child and adolescent mental health services in England. I have a number of other academic positions at universities in this country and abroad, and I've been an academic for 35 years, so I am a professor, and the definition of that is I speak in other people's sleep. So I hope not to do that this time, but that's what I am.
That's great, thank you ever so much. If we could begin, could you say in a few words what you believe the current quality of mental health services for young people to be? If you'd like to start, Martin.
Yeah, sure. So, well, I had the fortune to co-chair with the Department of Health, the task force on children and young people's mental health services. And I've also worked both as a GP and as a commissioner over the last 25 years. I would say that the current state of service delivery needs to be improved significantly. And we evidence that in the task force report. What is heartening as well is that we have a programme which has been going, which Peter has already alluded to, called the Children and Young People's Improving Access to Psychological Therapies, which has been based on quality improvement in established services within the NHS. And we have good evidence that improving services is deliverable, but we need to link them up with other important services across the spectrum of public services and voluntary non-statutory services. So I'm talking here about linking into education, local government, the NHS, and justice as well. And then, of course, there's a wide range of voluntary sector organisations. I know, Leanne, if you'd like to comment on the state of services. And I'll just sit back a little bit.
So I used CAMS, Child and Adolescent Mental Health Services. So from my point of view, I think they've come a long way, but I still think they've got a long way to come. And I think, as Martin was saying, communication is key here between different services, and like voluntary, public, private, all of them need to link up and communicate more.
Thank you.
I would obviously endorse what my colleagues have said. I would emphasise that there is a massive unmet need that everybody recognises in relation to mental health, but particularly in relation to child mental health. That at the moment we know that probably no more than 13% of adolescents with a clinical diagnosis are likely to get appropriate mental health treatment, particularly if they are male. And that is obviously a state of affairs that we do not wish to continue. What that indicates is that in some respects, all the services are, and I totally agree with Martin, are improving. They have further to go. We need to make services more accessible, more appropriate to young people, so that they want to use them, that they feel comfortable in using them, but also that it gives them what I think is most important in mental health. And I was referring to it, and Gift has done magnificent work in this area. Gives them the kind of agentiveness, the kind of capacity to make decisions for themselves, which anyone with a mental health problem is absolutely in need of. Therefore, increased participation, incorporating young people and designing services for young people, by young people, is really what should be the priority.
Thank you. Saskia?
Hi, I'm Saskia, and welcome to the Youth Select Committee. One of our witnesses last week, a doctor from Cardiff University, said that instead of people being seen early, it's only at crisis points that people are being seen. And we read that Baroness Tyler of Enfield last week in the House of Lords debate described mental health services for young people as the Cinderella of Cinderella services, completely swept to one side. In your opinions, why have mental health services for children and young people been allowed to reach the point where they are colloquially described as the Cinderella of Cinderella services?
So I think that there's a number of factors which have been at work, and I think we should applaud the fact that over the last 4 to 5 years there's been a huge awareness raising of the importance of mental health, both in children and adults, across the whole life spectrum. And what is encouraging now is that both the government, both the last government and this government, have said it is a priority. NHS England have made it a priority, and that there is also a growing awareness of the benefits to not only a health service but to communities and to the economy of addressing mental health purposefully. And I think that speaks to why it has perhaps been a Cinderella service in the past, because it's not been tangible. We haven't had data. We haven't had measurement. We haven't had an awareness. If you've got diabetes and you get complications, we can track those, or we have systems and processes to track those. If you have, you develop a psychotic illness in youth, which is actually what's hit me very hard, was to understand that 40% or more of chronic mental ill health starts before the age of 18. And yet we have not heretofore understood the impact that has, or tracked it on people's lives, on the resources we use. And people like Richard Layard and other economists have demonstrated that there is a moral and ethical duty for the individual, but actually there's even to back that up, there's a massive economic imperative to do this work. So I think we need to have better measurement, which is what we called for in Future in Mind, and will be delivered next year. We will have better measurement. We need better transparency about investment, which we have called for and we are determined to achieve over the next 5 years. And we've already laid down rules within NHS England about putting more money into mental health services. And I think also we need to make a clarion call to society and continue to strip away the stigma about mental health, and the courage for people like Leanne to come and talk about their own personal experience. I often say in big meetings, can anyone in the room put a hand up who hasn't personally, or someone very close to them, experienced mental health problems. And certainly my hand would not go up.
I think there needs to be a greater emphasis on that everyone has mental health. I think the terms mental health and mental illness have become the same and associated, so that adds to the stigma. So I think if there's more awareness on everyone in the room, everyone everywhere has mental health, I think that would do a lot for reducing stigma.
If I can just add to the stigma point, there's a recent survey by Place to Be that showed that about a third of parents admitted to feeling embarrassed if their child, if the young person that they were looking after wanted to have counselling in the school. And about a quarter of them actually said that they would not encourage that child, the young person, to take advantage of an opportunity to have counselling. Now, if the parent is saying that they are not in favour of child mental health, then there's really a major problem in society. And I would like to remind you of the statement that Nelson Mandela has made, which I really deeply, deeply believe, which is that there is no better revelation of a society's soul than the way it treats its children. And the fact that in this country we spend just over 6% of the mental health expenditure that we have available to us on children and young people is perhaps a revelation to the soul of the society, which speaks to, I think, Martin's point that in order for us to do something about it, it's not enough for NHS England, my employer, to do something about it. It's not enough for the NHS to do something about it. It's not enough for social services or local authorities. It has to be everyone's business that children's mental health, which is as much determined by the environment that children and young people are in, as it is determined by the small contribution that the health service has to offer to this. The children's mental health becomes a national priority. And that's really the clarion call that I would like you guys to make.
Okay, thank you.
Thank you. Leanne?
We've received lots of evidence over the past few weeks. One young person that gave evidence last week, Sadia Sajid, said that many young people are not aware of the services out there for them. In my local youth council, I made a suggestion as to whether anybody had heard of CAMS, the Children's and Adolescent Mental Health Service, and one of the girls did not even know what it stood for. We have had evidence that young people lack awareness about mental health and services available. Do you think that the treatment gap is down to the lack of services available or down to the lack of awareness of services that are available?
I think it's down to lack of awareness. To use a personal example, when I was at school, I didn't know much about mental health, so I didn't know the symptoms I was experiencing. My teachers, they didn't really know much either. The people around me, my peers, my friends, my family, I'd never heard of CAMS. No one around me had heard of CAMS, so this meant I couldn't access the services that I needed. So I think if you increase the awareness, you increase the ability to for people to get the help they need sooner. So it's like a ripple effect. And I think with GIFT, we did it was similar to what you're saying, it was sort of a mystery shopping type thing into CAM's website. So we went on Google and we typed in mental health services in different areas, and we found it was very hard to find mental health services for young people in the area unless you know the term CAMS, which unless you've been in the service or you know someone who's been in the service, you don't know what it is. So I'm not saying like advertise CAMS on buses or anything like that, but I'm saying the word needs to be out there of what services are available. So, yeah.
I would endorse as strongly as I possibly can what Liam has said, and would add to it that there is currently an initiative to create in every school a mental health lead who would actually be able to do exactly that kind of signposting, and maybe even better signposting. That the fact that it hasn't existed effectively up till now, it has been very variable, let's say, is a shortcoming, is a real indication of the problem. I think added to that, the importance of early intervention, so that by the time you are referred to, that your problem is serious enough to be referred to a specialist service, that in itself is a problem, and having levels of intervention that are appropriate to the young person's needs, or appropriate to young person's problems, that is not necessarily a simple distinction. Well, you are ill and then you get referred, but there is a kind of a gradual input of appropriate care throughout, is really what we need through the integration that Martin mentioned of a number of agencies working probably with education, but with families and communities as well.
I think one of the problems we've got around this as well is you don't look for something until you need it. And the NHS has a great track record of using acronyms which are incomprehensible, sometimes even to people in the NHS. So I thought for a while when I got involved in management that an FPC of 5 million was a very expensive full blood count, until I learned it was a full business case. So we do have major problems with being able to signpost people appropriately, and I think that's because sometimes we try to direct too many things from the centre. And one of the points of Future in Mind we put forward was that transformation plans for improving the mental health, support and access to mental health services for children and young people should be designed and owned locally against best practice and evidence. And that's something, having worked both in a number of local communities as a clinician and as a commissioner, I know that there is a lot of local intelligence, and those relationships have to be supported and enabled to improve things. So the centre should do only that which the centre can do, and the rest we should enable local communities to build relationships and trust and appropriate pathways of care or ways of working, because it'll be different in Barnsley, Basingstoke and Barnstaple. They're very different places to Birmingham as well. So I think that's really important for us.
Can I add a point? Yeah, I have a good example. It was in Kingston. It was about awareness. There was 10 local schools came together, so 10 people from 10 local schools came together to have a conference, and they talked about mental health, like just a general awareness, stigma, and local services, and like what the services are out there. And I think that's very important. The young people were very interested, the teachers were interested, and it really increased awareness.
Thank you. Sophie?
This is for NHS England. You said in your evidence that transition is poorly planned, poorly executed and poorly experienced. Who is responsible for making sure that services communicate effectively and ensure a smooth transition for young people?
I will walk straight into this. We are. And that's why we have created, first of all, when NHS England was formed, we created a National Clinical Director for Young People and Transition. That's why we put an emphasis on the fact that transition should not be defined by an arbitrary age, but by a need in Future in Mind. And we have put forward the proposition to people that transition should be considered up to the age of 25. Because someone might be 17 and might be ready to transition into adult services, but someone might be a lot older before they're ready to transition into services. That's why we've actually created for the system specifications designed with young people and parents, if you like, the working manual that people can apply locally to improve the way that transition happens. And I think as well as which we need to develop innovative and new ways of supporting transition, especially harnessing the potential and power of children and young people themselves. Peer support can be incredibly powerful, and there's a good example from physical health that was published in a journal a few years ago around renal transplant, where during transition up to 25% of the young people who'd had a renal transplant lost their transplanted organ, renal kidney, during that transition because it got muddled, they had adolescence, they had all the other things they were interested in, they weren't taking their medication. When they put in a peer support approach and facilitation, non-medical, to support that transition, over the subsequent 2 years, no child lost their kidney. And I think this is, no young person should lose the gains they've made with support from young children and young people's mental health services as they move into adult life. So that's our ambition.
I was going to say, maybe slightly arguing that point. I'm not sure if increasing the age range of leaving services is the answer. I think the problem here is lack of communication between services. So to try and help with that, GIFT and with the NHS England, we developed a tool called the Service User Passport. So the young person develops it with their therapist or their counsellor or whoever they're working on, and it's like a summary of their own information, so like problems, their history, what helps them, and they write it in a document however they want to, and then it gives them ownership of their own information that they can then take to another service when they're transitioning or moving between services, and it's up to them what information they want to share or if they want to share it. So that's trying to combat some of the issues of lack of communication and feeling like you're losing work done when moving between services. So I think what it goes down to is communication.
Okay.
Hiya, welcome to Select Committee. My question is to Martin and Peter, based on what you submitted to us, that you said to ensure a smooth transition between a young young services of CAMS to adult someone's. The local authorities and CCGs will use a model specification, as you said, and also a sample discharge to when they are needed to discharge. But my question to both of you is, how are you going to monitor that local authorities and CCGs are actually using that service and it's actually being effective? So can I start with you, Martin, please?
So it's a timely reminder from Leanne, and that's why we've got working with people like Leanne to challenge us and to help us co-design the services. And that's actually where we need to get the feedback from people about whether this is working. Mm-hmm. Too often we just look at what I would call input data, have targets been met? Actually, that's quite important for people, but what's really important is the experience they've had of the service. So I don't think we have the perfect solution yet, but every, say for instance, the Children and Young People's Service, IAP transformation programme, has been built around building in outcomes, which are reported by the, if you like, I'll call them customer owners, the people who help us design the service because they are recipients of the service. And we are going through, I'm working at the moment on a data set which goes right across the life course, because we've got to change this in adult as well as in children's, which actually reports that back to us about whether there has been compliance with best practice. Are we there yet? No. Will we get there? We're working on it. But does that need to be held to account? Yes.
Thank
you. We agree entirely with Martin on the importance of measurement and transparent reporting of outcomes, and I think what your question implies, accountability.
Yeah.
And accountability that is public accountability, that is statistics that are publicly available. And the Improved Access to Psychological Therapies programme has always been committed to that kind of public accountability. To drill down slightly to the substance of your question about transitions, there are really important developmental reasons why transitions between child and adolescent mental health services and adult mental health services is so difficult. And that's really to do with, if you like, the nature of the beast. That young people have particular specific needs that at that age that are poorly met by either CAMS or by adult services. And in other countries, there have been special provisions made, and I think there's a lot of experimentation in this country, one that I'm involved in Camden, that we call Minding the Gap, and the title says it all, of how to create services that are appropriate for a young person with the kind of concerns that individuals around between the age of 16 and 25 have, that are unique concerns, where mental health overleaps with a number of other issues. I don't think, and I agree entirely with what Martin said, I don't think that there is an overarching solution to that. The solutions will have to be local. And will have to be ones, exactly as Leanne has emphasised and Martin has emphasised, that are developed together by all the stakeholders, particularly by young people. But our responsibility is to facilitate that process, to oversee that process, and to ensure that that process results in something that is accountable.
Just to obviously go further with that, we said that you have provided the guidance for the CCGs and local authorities to use, but are they actually sufficient without any adequate resources or any proper training for them, and just giving them the guidance without knowing if they're actually ready for it? So, Martin?
Yes, I think that's so it points to, again, one of the 5 themes that we put in, 2 of the 5 themes that we put into Future in Mind, which was around supporting training and development. And actually, Peter will speak to this more cogently than me, but that has been a major part of the transformation programme for CYPI the natty acronym we have for improving mental health services for children and young people. I think on resourcing, absolutely, and there has been. I think that there is. We are at a pivotal moment at the moment in the whole what's called the comprehensive spending review and commitments around resourcing, where we hope that there will be the commitment that was made prior to the election around increased funding, and also the fact that that as we move forward, building on the blueprint we set out in Future in Mind, that actually transparency about investment across the whole system, not just the NHS, it becomes the norm, so we can see how resilience in schools, the voluntary sector, as well as services from the NHS is being supported.
Just to pick up from Martin on the issue of training and CYPI, the natty acronym, has succeeded in training, if I'm correct, and I apologise if I get the numbers slightly wrong, but about 872 therapists and about 250 supervisors and 178 service transformation leads. We are trying. There is much, much more to do, but the training is the most important part of achieving the kind of transformation that I think we are all after. On the resourcing side, I was very encouraged by the speech made yesterday by Alistair Burt to the Royal College of Psychiatrists. I don't know whether you had a chance to see it, but the first half of the speech was, in essence, about children and young people, and was about what appeared to be a clear commitment that he was making to at least recognition of the importance of the problem. I think it cannot be achieved without resources. I think those resources need to be appropriately directed. Part of that needs to be training, and part of it needs to be some kind of robust and transparent implementation that assures accountability.
Thank you.
Thank you. Francesca?
So, in the March 2015 budget, extra funding was agreed by the government for specific schemes with the aim of transforming mental health services for children and young people. So with regard to these extra funding commitments, do you have any specific concerns about whether the funding committed by the government will be made available or how that money is going to be spent? Martin, would you like to start?
Yes. So I think one of the things that we've got is we have had a kind of cycle of commitments being made around funding, and that has come true. So we have money which we're investing this year around eating disorders, around increasing scope of CYPI Act. But there was a major commitment or intent set out off the back of Future in Mind, and we anticipate and hope that will be seen through. But we live in a democracy, and there are multiple competing priorities. I think one of the things that will help us all is the fact that we have set out that we want to have greater clarity about the money we've got now, how it's being used, and how effectively it's being used. Because my experience has been working around getting better value for health services over the last 10 to 20 years has been that, and once you start looking at how we're spending the money, you can sometimes find out quite quickly we can do it better. So sometimes you need to start that with some extra money, but I think the CYPI Act programme is a really good example of this, that if we give people the training and skills in effective implementation of good quality services, they can often use the money we've got now to better effect and reach more people. So I think we have to do both and. One is we have to keep fighting and nagging for extra money, but also we have to be honest and be transparent about how we're using the money we've got now to best effect.
If I can pick that up, Francesca, the one example is the £30 million committed to development of community-based services specialising in the treatment of eating disorder for young people. I've had the privilege of chairing an expert reference group to design a blueprint really for commissioners to deliver such a programme. As part of this, we want to assure that any young person presenting with eating disorder in an urgent case is treated receives treatment within 1 week, and a routine referral within 4 weeks. An emergency, one presumes, will be treated immediately. I think this is a really good example of what Martin was saying about money being well spent. It's not that up till now there has not been money spent on eating disorders. There is a massive amount of money being spent on eating disorders or inpatient treatment of young people who presented with eating disorders and are treated at a time when their body weight is so low that we know that their brains no longer appropriately respond to the treatment that they're offered. So rapid feeding is actually part of an effective protocol. We know that this can be achieved as effectively in a community, as part of a community service, as an inpatient service. But if the community services are not there, then referrals are made to inpatient, and because they are often delayed to a point where the money is no longer used as efficiently as it would be for an early intervention service that was available earlier. So it's a long-winded way of answering your question, that there is much that we can do. There are probably no overarching answers, but there will be answers in specific areas. And I think eating disorders will be perhaps a good model where access and waiting time parameters, standards, will be appropriately used in order to improve overall effectiveness of the treatment and also cost effectiveness or money better spent.
Thank you.
Rowan?
Hi, I'm Rowan. Barbara Raymond from Youth Access last week explained her experiences of increasingly limited funding and how, in her own words, voluntary sector organisations are being pitted against each other by the current culture of more contracting and scarce resources. Sarah Kenyon from YMCA Surrey then mentioned today how the use of voluntary and community sector organisations allowed a more cost-effective service provision. Are the savings being made here by using the community and voluntary sector, reducing budgets, and by contracting, reinvested in other areas? Could we start with Martin on that one, please?
Yeah. So this is one of the complexities of the current system, is that benefit in one part of the system is realised in another, and the budgets are separated. If somebody does something down the road and I get a reduction in costs, am I going to walk down the road and give them that money? Well, obviously I would personally, but I believe that some people wouldn't. Well, maybe I wouldn't, if I'm honest. And that is, joking apart, that is the real problem here. And that's why we've asked, but it is your money. It is the taxpayer's pound. And so somehow we have to break through these perverse incentives, which is why in Future of Mind we talked about having transparency of funding, why we said that actually ultimately we should be seeking to look to see whether we could pool budgets, but not lose track of effectiveness. This ultimately is one of the biggest things I think the whole system is wrestling with, where certainly local authorities are, have taken significant cost efficiencies, and done. I think we should also acknowledge that they've done incredibly well in many areas in managing that tight constraint they've been faced with. But what we need to do is learn how to realise benefit in one area, release the money from the other area where the cost is accrued, feed it back to make it sustainable, and that's what the 5-year forward view also sets out. We need new models of care, we need new incentives, we need new measurement. And in the 21st century, we've got to learn to do things differently, especially around long-term conditions, of which mental health is part of this agenda, and that's something that we are wrestling with. I will not try and pretend that we've got the answer, but I think increasingly people are focused on working at how do we do this. So a great example is the devolution agenda in Manchester, where they're looking at pooling money together and saying, and I think this reflects the fact that we cannot direct things from this small 1 mile bubble around here. Westminster can't pull levers and make things happen in areas in the country. What it can do is create an environment that enables the right thing to be done and hold people to account for doing that right thing in local areas.
It's a very good question. I don't have very much to add to what Martin extraordinarily eloquently has already said, but the issue is really integration that you point to, Rowan, as far as I can tell. Then voluntary organisations, as Barbara pointed out, are suffering because of the withdrawal of funding, particularly from local authorities for CAMS. I think she's both saying the truth, and it's also something very important for everyone to take notice of. In CYPI we have been working very hard to create local partnerships that included the commissioners, included the NHS service providers, but also included voluntary sector service providers, trying to work together, trying to create a community that was together responsible for delivering the best care for the young people. My strong view is that whilst you retain, that you can say that let's pool budgets and let's hope that that'll all happen by itself. It may or may not. I wouldn't hold my breath on that one. You pool budgets, but it looks like it's pooled, but then, I just kind of hijack a little part of it all to me. As in, families have pool budgets, but you notice that different members of a family keep money nevertheless separately. So the principle to me that will ultimately work is that we have to collaborate on shared outcomes. That if we are actually pushing towards the same goal, then somebody else succeeding means that we are succeeding. That if we play more like a football team, and that there is just one goal, and that it doesn't matter whether you're the goalie or you're the striker, actually the whole team has to work together in order to win the match. And that, I think we have, as Martin says, I totally agree with him, we have some lessons to learn on that. But I think we are trying to work towards it.
So that's more of an aspiration than a current reality?
Oh, I think so, yes. I think we just have to be honest. That is what everyone around the country knows, and there are many different if you like, pilots and attempts, but the principles have been clearly set out in Future in Mind. We have guidance for local areas which will be forthcoming this year around assuring ourselves that people are taking this approach, and any funding that is released, one of the things we kind of did put a lock in the system, that any funding that will be released will be consequent on people having those clear plans in place. We're not saying exactly what you need to do in that area, but what we want to be assured is there is clarity about what you are how you are going to do what is needed.
Thank you very much.
Thank you. Ewan? Hi, I'm Ewan. In the written evidence we've received from young service users, often waiting times have been described as very long and sometimes exacerbate the condition that they're suffering from. Also, between areas, there's often disparity in how long the waiting times are. So I was wondering, would you be able to clarify whether there will be waiting time standards introduced across all children and adolescent mental health services, and when will these be in place? If we could start with.
So that again is one of the things that we're working towards for next year, is to have the data set, because we actually don't have a national data set at the moment, which will give us that sort of information on a reliable basis. So we're working with the Health and Social Care Information Centre to establish that data set, both for children and for adults, to have implemented across the country so that we can measure waiting times. We also, for improving access to psychological therapies, we introduced the first waiting time standards last year, and we've been measuring ourselves against them. And it's an important point you raise, because some people have said, well, you were achieving those waiting times already, but having that transparency locks them into the system for the future, so that we can't regress, which unfortunately we have evidence of that happening in the past, where we've made investment, we've improved things, and then because we don't have that transparency, things regress over time. So we're working towards that, and over our aspiration over the next 5 years is to have that comprehensive data set, and it become as normal as we have for many areas of physical health at the moment.
I was thinking, I think waiting times are a really big issue, but I think part of that issue builds into the last point, and that services feel they are competing against each other rather than working together. So I think if they used, if different services made use of other services, such as voluntary services, and communicated together, I think that will help to reduce the waiting times. So I don't know how they do that. Maybe that's with joint training, so different services learn about different services and how they can work together.
Just to pick up your question about how it's going to be rolled out. We are working, so eating disorders, for example, the waiting times I mentioned, we hope that this year, the first year, 75% of cases will meet those targets, and that will gradually increase, hopefully, to 95% by the end of this Parliament. But to pick up Liam's point, what can happen and what distorts the picture, say that there's a social worker who is asked to close a case, although they have developed a very good relationship with a young person. And they're asked to close the case, they was, well, this person has a mental health problem, I'll refer them to child and mental health services. So they close the case here, although they could quite easily carry it on, but they need to close the case in order to meet their targets. And then they put the person on a waiting list for another service where they have to. So you could create very good waiting time statistics by closing cases and then churning the system, if you see what I mean. They just send. Now the point that Liam is making is so important is if systems are working in a joint way, working together. Then I think the most effective program of treatments can be designed for each person, and that in itself will reduce waiting times and improve access. And I think until we achieve those, and that's, as Martin says, what I think everyone in the field is currently working on.
Thank you. Would you be able to tell me what action would be taken if the waiting standards were breached?
So, first of all, there's accountability at a local level. So one of the things we've said, there should be a lead commissioner, and a lead commissioner has responsibility and authority to hold providers to account. And that can be done, one of the things we said is, in the establishment under the reforms in England, there are local health and wellbeing boards where people come together, but also that as part of the governance and accountability under what we've proposed in Future in Mind, there should be that lead commissioning arrangement across health, local authority, working with education to hold the providers to account. Thank you.
We still have quite a few questions left. I don't stay much longer after 3 p.m.
I mean, I'm happy to stay for a little while, Leanne, are you? Yeah?
Yeah, Savan, that's absolutely great. Thank you. Laura?
Good afternoon, I'm Laura. The committee has had evidence that there is a strong desire from young people to be involved in designing and promoting services. Martin and Peter, you'll be aware that the Future in Mind report states you, that's young people, are experts in your care and want to be involved in how mental health services are delivered and developed, not just to you and those who support you, but to all the children, young people and families in your area. So Leanne, what has been your experience of working with CYPI apps, that's children and young people's improving access to psychological therapies? such a mouthful. In relation to involving young people in designing and promoting services.
I'm not just saying this, it's been amazing, like working with them. I feel like I've sat on board meetings, spoke at conferences, helped design conferences, worked at a local level, national level, and it's really brought a different angle to the meetings. I feel we are very valued as young people, maybe more so than some of the professionals in the room. We're really listened to, and they really take into account what we say. So at a local level, with participation in the different services, they run groups. So I work with Derby Participation, and we do things like small things from what the waiting room looks like in CAMS to bigger things like sitting on interview panels to what the staff who are employed there. And then with GIFT and CYPI Act, it's the conferences, the meetings, and yeah, it's just really good. And I think it's the start of something brilliant. I think at the moment it's new and it's just been trialled to see how it goes, but I think that is very much the way forward. Yeah.
Great, thank you.
Thank you. Ryan?
Hello. Goodness me. I am sick today. Hello, I'm Ryan. This question is for NHS England. In your March 2015 report, which was principally to develop a 5-year national strategy with mental health, were any young people consulted in that? And if not, why?
Yeah, so I just like to pick up on what Leanne said, and first of all, I'd just like to give credit to the team led by Catherine Pugh and to the Department of Health for the way that the CYP programme was set up on the principle of co-design. I know Peter's been deeply involved in that. I can take no credit whatsoever for that, but I'll ride the acclamation of it. And that was reflected in the Future in Mind task force. So I've got some figures here. Over 1,100 children and young people and over 400 parents responded to online surveys. There were 800 male respondents completed a poll. There were 17 discussion groups as well as telephone interviews. And throughout the task force, each of the task force working groups that we had representation and engagement and involvement. So I think it would be ludicrous for us to think that we could develop services for children and young people that were not informed by their insights and their experiences. So I think that's where I'll stop.
Just to add to that, we followed Harry Truman's advice on this. It was when asked on how he gives advice to children and young people, said that first of all, ask them what it is that they want, and then I give them the advice to do it. And that's really very much CYPI's principle as well. Basically, as I said in my opening remarks, we deeply believe that actually a very important part of recovery from any mental health problem is giving the individual who suffers from mental health problem the agency to make choices, to make decisions for themselves. Because when you have a mental health problem, that is what you lose, that's what feels worse as part of it. You no longer have the kind of freedom of action that you thought. You feel you have to do things in a particular way. So part of giving young people a voice in relation to their own care, doing what we call shared decision making about their care, also introducing routine outcomes measurement, that is, they indicate at the end of each session they have with their treater, their therapist, was this, whether this was useful or not, actually is an enormously important part of their recovery, because them feeling that their response is then taken very seriously by the person. So that next, if they said it wasn't particularly useful, then next time actually that person does something different. Now, it's not only useful because they do something different, but it's also useful because they have been taken notice of. And that is, I think, is a deep recognition that goes through the Children and Young People's Improved Access to Psychological Therapies program, but I think also under Catherine Pugh's and Hurley's and others' leadership, the entire service transformation program that's underway for children and young people's mental health services. So we are right there.
Thank you.
Liam?
I just wanted to quickly make an apology because I don't think I introduced myself earlier. I'm Liam. Thank you for coming. Last week we met with young people and they gave evidence to the committee, and with regards to engagement, one panel member was talking about young health champions, and in terms of engagement, the other young person that was on the same panel had no idea about what a young health champion was. Similarly, North Tyneside member of UK Youth Parliament, Rebecca Moore, spoke about a website called Mindful, whereas other people who were on the same panel and in the room had no idea what Mindful was. We now know that Mindful is an online mentoring charity and service that provides online support for young people suffering mental illnesses. What is the most effective way for the government and the NHS to involve young people in communicating and designing services?
Well, yeah.
You'd
like to kick off on that?
Well, getting young people involved in as many processes and steps as possible, if and when they want to. I suppose if you're designing a service for children and young people, without young people, I always say it's like getting dressed in the dark. You think what you've chose is appropriate until you turn the light on.
That's right.
That's
actually anyway. I think this is really important. It comes back to exactly that point. Is by asking young people to test mystery shop websites and the sort of material that's put out by NHS services, for instance, we can tell the ones that have involved children and young people in their design, and those which have been, designed in back rooms, as that's what children need.
Can I just quickly say also, the reason why I gave these two examples is because I think there might be a sense of confusion in terms of liaison with young people, with the government and the NHS, and I think that's the impression that the committee got last week as well through the evidence.
Yeah, can I address one particular aspect of what you said? I think it's a really important issue. I think ideally information should travel around a single channel and should be coherent. In practical, in the real world, young people access information in very many different ways. One of the important learning for, I think, most of us is that by the time we get on top of a new channel, it has already moved. It is not something that a system like government or NHS England is able to respond to in a sufficiently nimble way to as it were, make that mainstream. I work with an organisation called Silent Secret. I don't know whether you've come across it. It's a group of young people who have developed an app where young people can disclose their problem and no one can respond to it. But everybody can read about it, but it's not something that anyone responds to. And it's enormously popular with other young people. And we are trying to link an advice service to that. But that's one particular application, and there are hundreds of applications. But I tell you what I'm really concerned about, and I don't know how you can make this part of your report, but I would really like you to take it seriously. That we now know that internet use is actually positively associated with both self-harm, depression, and suicidality. That is, more time a young person spends on the internet, the more likely they are to have. Now, I'm not saying that there's a causality. It could be some young person has problems and that's why they're spending time on the internet. But for example, a study in New Zealand has shown that 80% of young people who are self-harming got the ideas about self-harming from the internet. So before recommending the internet as the answer to everything, I think we have to be careful about these two aspects. That is, one is the rapid change of this, and the other is I think the even greater problem of the toxic potential of the internet. That's just I've got a slight hobby horse there.
Thank you.
Thank you. Francesca?
So just going on to the topic of training, in the future, in Mine report, it states that anybody who works with children and young people in universal settings such as early years provision, schools, colleges and voluntary bodies should have training in children and young people's development and behaviours. So with regard to this, what do you think should be the minimum level of training in mental health for those working with children and young people? Leanne, would you like to start?
I think we have a wonderful program called MindEd that gives a basic introduction to mental health problems to anyone working with a young person, be that a teacher, a youth worker, a police, somebody working with police, youth justice, that gives, and that has been enormously successful with, I believe, over 30,000 of the sessions that the program presents already viewed, and I think over 16,000 workers registered on it. That has to be extended, I think, or I believe there is a Department of Education initiative to expand it to parents. I think parents work with young people. I think they should have education in mental health. I think young people should have education in mental health. One thing that we now understand is that used to be thought, people like me thought, that really as long as we dealt with parenting and we made parenting better for young people, we would protect them from a degree of harm. It turns out that actually from a number of longitudinal studies, including one in this country and one in the United States, that far more or as risky as adverse childhood experiences from adults are adverse childhood experiences from other young people. That is, actually peers do more harm to young people. So that needs to be part of the educational process. That needs to be part of what teachers deliver for schools. In terms of the professionals, I think there needs to be training in three aspects, key aspects of working with the young person. Firstly, needs to be training in evidence-based treatments. I mean, everyone needs to know what the treatments are that work. There is, because the wastage of resources that we talked about. Secondly, there needs to be training in how you work with young people in shared decision making, how you can activate the young person's capacity to join you in a treatment program. Thirdly, you need to be trained in how to observe the impact of your training and your intervention on the young person that you're working with. Now, then we have tried to encapsulate that in a training program called Enhanced Evidence-Based Practice, which I believe we have now trained about 300 people in. I would like to spread that to every individual.
Peter, I think one of the things we need to mention as well is that this is work that we do with Health Education England. So there is an arm's length body that we work with, and we'll be working, part of the funding that we're seeking will be going to Health Education England to support the sort of training and change in behaviours, certainly within the NHS. There is the MindEd portal as Peter has referred to, but I just wanted to clarify that as well for the committee.
Thank you.
Hi, I'm Terence. The question I have is specifically to Martin. And so the question is, there was a letter to the Times today from senior professionals across the health service about a proposed cut of £200 million to public health budgets. And so can you give the committee any reassurance that these cuts will not fall on mental health services for young people?
Qualified. If I'm honest with you, I don't know yet. But what I would say is that's exactly why in Future of Mind we ask for transparency, because unless we can, as citizens and as taxpayers, see where our money is going, then I can't answer that question. and I'll be quite honest about it. I think that the profile that we've given this agenda, that has been given this agenda by the previous government and by this government, will mean, and the what we set out in Future in Mind, will help militate against that. But we're going to have to be very vigilant about it. So I'm not going to say yes, and I'm not going to say no. And I think it is a real concern.
Thank you. And the final question is for each of you. If you could see one recommendation within our report, what one recommendation would you like to see? If you'd like to start, Leanne.
Well, following that, I'd say more funding, but alongside, I'd say increased communication and integration of services.
That's great, thank you. And Martin?
I would say that politically and policy-wise, this remains high priority for the next 5 years at least.
If I can just cite Senator Perry, who actually said something very brilliant. So what he said was that if you want to drum up people to build a ship for you, to collect the wood, you don't just assign them tasks, but rather teach them to long for the endless immensity of the sea. What I'd like you to do is to try and concentrate on not just the immediate things that people need to do, but really what is it that we are trying to achieve here, which is really a future where children and young people receive the mental health service that they deserve. That goal really has to focus all of our minds. There is a tremendous opportunity to improve the world. We have a lever here to improve everyone's well-being through improving young people's well-being, who influence each other, and therefore the person's well-being who's suffering will improve everyone's well-being, but also who are the future, who will actually improve well-being of everyone else, going all the way until they get to my age, after which forget it. Do not lose sight of the tremendous opportunity that improving the mental health of children and young people actually represents for all of us, not just those of us working in this field, but everyone around us, not just now, but also in the future.
That's great. Thank you. Again, thank you all ever so much for your time. And with that, I end the fourth panel of the day.
Thank you very much indeed. Thank you.
Hello everyone, and we'll begin our sixth and final panel of the day. First of all, welcome. I'm Rhys Hart, I'm the Chair of the Youth Select Committee. Thank you for joining us, and we know you're very busy, and so it's highly appreciated that you've come here today to speak to us. Just to let you know about us, we are an inquiry into mental health, specifically young people's mental health, looking around the topics of stigma, awareness, education and services provided. This session, for the beginning, we'll mainly be looking at the topic of services, and then we'll move on more onto the topic of education, and then we'll kind of branch it out more into the general realms of young people's mental health. First of all, it'd be very useful to us if you could introduce yourselves and just say a brief line about the position you hold and how that's relevant to mental health. Thank you. Would you like to begin, Minister?
Yeah, well, thanks for having us here today. This is a very important topic for the government, but more importantly for those who suffer from various forms of mental health need, who are not getting the support that they should get. I am the Parliamentary Under Secretary of State for Education and Childcare, and the first Minister in the Education Department who has a specific responsibility for mental health in their brief. And this has started towards the end of the last Parliament, so I've been reappointed into the job, and I'm carrying on in what I see as one of the most important roles in my portfolio.
Thank you.
Good afternoon. I'm Alistair Burt. I'm the Minister of State at the Department of Health with responsibility for community and social care. This is quite a wide remit that covers everything about out-of-hospital care, from primary care right through to adult social care. But mental health is a distinct part of the brief, and as has been made clear by the Prime Minister and Secretary of State, a priority for the department. We are increasingly working in close cooperation with those in other departments. So, as the Minister has said, we're very appreciative that you wanted to see us both, and that we hope our presence together symbolises something about the determination of how government is planning to handle this. So, thank you for seeing us, and thank you for the inquiry you're undertaking.
Thank you. Liam, if you'd like to begin.
Thank you very much. Good afternoon, ladies and gentlemen. Welcome to the Youth Select Committee. My name's Liam Islam. The committee's aim this year is to gain a greater understanding on the government's position on mental health. What is the government's assessment of the quality and availability of mental health services for young people? And Minister Gyimah, we'd like to start with you first, please.
Right. Well, in terms of the quality of the services, obviously I sit and I look at it primarily within the Education Department, although this is an area in which the Health Department has a significant role. Your question pertains to our assessment of the quality, and if I'm to give you a brutally honest answer, I would say that there is a lot to do to have a fully functioning mental health service that serves the needs of young people. And that is why in the Education Department we have taken a number of steps in the last few months to begin to improve the nature of the service we've got. So apart from appointing someone specifically for the job, there was a joint task force at the end of the last Parliament between Health and Department of Education, where we looked at some of the challenges and the barriers around the system and the services, and I'm sure my colleague can talk about that in more detail. In addition to that, what we have looked at in the Education Department is we funded the PSHE Association to publish guidance about the teaching of mental health in PSHE, alongside lesson plans that will be published very shortly. And the reason for this is that we see that we've got to tackle this within the school system. Mental health issues are a barrier to children fulfilling their potential within school. It affects a significant number of children, I think something like 10%, but also it is the explanation behind some behavioural and attendance issues that we see in schools, and that is why funding the PSHE Association to be able to teach and open people's minds to what the challenges are has been very important to us. Further to that, we made £4.7 million available for 17 projects, mental health projects. These are projects led in the main by voluntary and community and sector organisations, includes projects to promote positive mental health in schools and set up networks of young people acting as ambassadors in their schools. And further to that, just to sort of round off, we, together with the Department for Health, are investing £1.5 million in piloting a joint training programme with NHS England so that we can develop lead contacts in schools and specialist services to make sure that the system going from education into health works as smoothly as possible.
Mr. Burt.
If I may, could I also give a slightly longer answer to this question than I'll tend to do to the others, because it puts some things on the record right at the beginning. If you don't mind, I'll read some of this. My job is to support the development of mental health care in the United Kingdom, particularly children's mental health care. First and foremost, I follow a very good predecessor, my Liberal Democrat colleague Norman Lamb. And I think sometimes it's important to demonstrate continuity of care, particularly where other parties are involved. I think that gives people an impression that we treat this with the seriousness that it deserves and it's not a party political issue. I'm committed in my role to transforming children and young people's mental health and well-being across health, social care and education. This is backed by the recent investments we've made in eating disorders, £150 million over 5 years, and improving in young people's mental health more generally, with the £1.25 billion to be allocated over the next 5 years. The Future in Mind report, published on the 17th of March 2015, sets out a vision for improving children and young people's mental health and well-being, which we intend to take forward. We commissioned Young Minds to survey 1,600 children and young people so that their views could be represented in this report. The first major step for achieving sustainable system-wide transformation is the development of local transformation plans. Local areas will be asked to set out how progress will be made in each area across the country. We're working with partners, as I indicated a moment ago, across the NHS, local authority, youth justice and education sector to make this happen well. A number of the 49 proposals from Future in Mind are already being delivered and developed, including the extension and expansion of the children and young people's access to psychological therapies programme, so that by 2018 all local services will be in receipt of this transformative programme. The commissioning of a new prevalence survey on mental health problems in children and young people, the first since 2004. Joint training pilots between schools and children and young people's mental health service providers to strengthen the mental health advice and support available in education settings. Improved services for perinatal mental health and eating disorders, both of which will be addressed through work this year, and plans for legislation to prevent any children or young person being put in a police cell as a place of safety during care in a crisis. And finally, in this section, the development of a hard-hitting anti-stigma campaign. So the overall sense is the development of services is very much work in progress. We've recognised, as the Minister has said, the need to do more. That's why there's been a very strong public commitment to it, both political and financial. Services can vary in terms of their delivery across the country. I'm sure you'll ask about the availability of practice. And I think it's part of my role to try and ensure that what is the practice of the best becomes the practice of all. So in general, our sense is these services need to be improved. That's why we've made the public commitment to do this for children and young people's mental health services. We have plans to do so. These plans are being drawn up in conjunction with users, with those who are involved in the services, with professionals, those who depend on them, parents and carers, and this will give us the blueprint to take forward, and we have started on that process.
Thank you. Hello, my name is Paul and welcome to the committee. The task force report Future in Mind is showing that since 2011 NHS expenditure for adult mental health has increased. However, the expenditure for young people's mental health has actually gone down. Evidence this committee has shown that this has resulted in longer waiting time, stretched resources and a mounting pressure for change. The recent government spending commitments, they're welcome. However, in what ways will these new spending commitments lead to tangible outcomes? And would you be able to start on that, Minister Burt?
Okay, thank you very much. It's hard to put a total figure on the amount of money that's spent on children and young people's mental health services. That's because part comes through the NHS, part comes through local authorities, through CCGs and a variety of different sources. The best figures I can give you is that we reckon that from the NHS mental health expenditure of 11.3 billion, some 700 million pounds, that's 6% of it, is the children and young persons mental health budget. But that only represents the funding for Tier 4 services and some Tier 3 services. The rest of the funding, Tiers 1 to 3, comes through, as I say, other sources, so it's difficult to get the full picture. But your overall point, that we do need to resource this better, is accepted by the government, and that's what we've set out to improve. Hence the commitment to the £1.25 billion over the next 5 years. In terms of what it's already going to and what it might go to, funding is going initially to the IAPS programme. That, as you are aware, is the early access to psychological therapies, which is already proving really very interesting and exciting in the field. To demonstrate that the earlier the intervention, the better, with profound consequences later on. So we're looking to expand the access to that. Only 68% of the country has access to this at the moment, and we need to complete that job. And we want to also use the money for extension to new curricula to include 0 to 5s, autism, learning disabilities, counselling and combined treatments, as well as supporting young mothers. So this is a programme which will last 5 years, so accordingly it's going to be delivered year on year, so it's not detailed right the way through the 5 years, but in essence it's to transform children and young people's services. That's where the extra resource is going to go to meet exactly the sort of criticism that you and the committee will have.
Thank you.
The only, if I may add, the only comment I would add to that from the Department for Education point is that I mentioned £4.7 million that we gave in grants for 17 mental health projects. That's the first time that a department has actually, within its total spend on grants, given mental health its own category. So for the first time, we identify mental health as a separate category that we would look to fund to make sure that we have voluntary service organisations coming up with ideas to improve what we're doing on mental health in schools.
Thank you. Thank you. Terence?
Hi, I'm Terence. The question that I'm going to ask is specified directly to Minister Burt. And the question I have to ask you is, the professionals we have spoken to all agreed the investment is welcome, but that it's only the tip of the iceberg or drop in the ocean. Do you agree? And if so, what do you plan on doing about it?
Even though I've only been in my job for 6 weeks, if I had a fiver for every time people said that £1.25 billion was a drop in the ocean, I would already be a wealthy bloke. Every service that we look at would make the same plea for extra resource. You're absolutely right to home in on it. As I said, I'm responsible for GPs and primary care services to everybody. Adult social care. There's going to be 1 million more people over the age of 70 in this country by 2020 in 5 years' time. So, although I take the point, and anyone advocating for a particular group in society or a particular need would say what you have said, and the professionals would say the same, I do think it's not unfair for government to say, do set it in the context of a very large public expenditure bill on health already, £110 billion, which is real money, and therefore the additional sums that have been put in are very genuine. But I start, as we have both done, in acknowledging that this determined change in approach from the coalition government through ourselves is a recognition that the services have not been appropriately funded in the past. So we know we've got catch up and we've got work to do. We will achieve it by what I've just said in answer to your predecessor's question about using this money both for access to psychological therapies and others. But I'll also be looking at the variations across the country. I'm sure one of the things your committee has probably found out is that there are so many variables. Why are beds available in one part of the country but not another? Why is it that in one place a parent or carer gets some of the service they want, in another place exactly the same provision which could be made isn't? I'm not entirely certain that it's always due to resource. It might be due to lack of information, different priorities. I think it's my role to try and see what I can do to ensure that these variations are evened out, that the practice of the best becomes the practice of everyone, and I'll be keen to do that. Where we can see particular bits of investment, we'll make it. For instance, last year we invested £7 million to provide 50 extra CAMS Tier 4 beds in the North East and the South West. And there are individual bits of work you can do for specific services to bring them up to a particular standard. But in essence, as I mentioned before, we will work very much with people locally. What are the services they think they need? What are the improvements they wish to see, bearing in mind the variations between themselves and another area? What is it they see being done in a neighbouring area that they want to say, we want to get done ourselves? And what is the process to bring that about? That, I think, is the way that we will lever up the standards all round, and I see my role as being part of a partnership with colleagues in government as well as those outside to make the changes and the gains we want to see.
Yeah, thank you.
Thank you. Rowan?
Thank you. Good afternoon, Ministers. I'm Rowan. The committee heard last week from Barbara Raymond from Youth Access. She said that she has seen not just cuts in CAMS, but across social services and in the youth service generally. Therefore, she went on to say, many people call NHS CAMS because there is nowhere else to go, and it has put other pressures on the system. The impacts of cuts elsewhere on CAMS services was also mentioned by Professor Peter Fonagy of the CYP IAPT programme, which is the Improving Access to Psychological Therapies programme for children and young people. How will you ensure that future and current local authority cuts do not impact on your new funding, which you explained at the start? And if we could start with Minister Burt, please.
Okay. In order that I don't do all the talking for the department, I'm going to ask my colleague from the department, Flora, to say something about this in a second, who has worked in this area for some time. But let me give a general political response to this. As you are aware, and as we indicated earlier, all the funding does not flow through the NHS and through the department. It does flow in other areas. Without having a system that is totally directive, that is where a minister is entirely responsible for what each area is doing and correct and commands or directs what's to be spent. We do have to leave it to local areas to respond to the needs in their own area. There is a democratic system to do that. Part of the way in which we think the process is leveraged is by exposure, transparency and the like. It's one of the reasons that the Secretary of State for Health has been so keen to measure what services are providing so that people can see what's being done, can measure one area against another, and can see if a particular subject is light in the way in which it's being handled. We feel that's been true in relation to mental health services generally. I also feel that as far as local authorities are concerned, they will be required to explain differences between one local authority and another in what they're doing, and we hope to encourage them in the right way. It is this difficult balance. We're responsible. You're entitled, as colleagues in Parliament are, and the whole process of accountability is to make us accountable at the end of the day. We do our work by not making everyone directly accountable to us on a direct line of you must do that, but saying, what's your response to this in your area? So our work is partnership and encouragement. But if Flora could say a little bit about our relationship with local authorities and how we've handled this difficult issue in the past.
So I'm Flora Goldhill. I'm the Director for Children, Families and Communities in the Department of Health, and children's mental health is one of the areas of my responsibility. Just to add to what the Minister has said, I think what we are expecting is local transformation plans to be developed in partnership with local authorities, schools, local communities, in order to think about how to use money that's coming on stream to change services so that we don't have the problems that we currently have, where these services are all pushed up to the most the most acute level, so that we invest much more in early intervention, in prevention, in building resilience in young people, so that we invest for the future in that way, so that fewer cases of mental ill health actually need access to the NHS for services. So that is how we hope to transform services in future, and that will involve a partnership with local authorities. And these transformation plans will only be funded if they can show genuine partnership and show how they are going to actually change services on the ground.
I appreciate that, and I really take the Minister's kind of real passion for this issue being dealt with, and I know it's also the NHS England's second corporate priority. So is there any guidance that you could send out to local authorities? Because of course it is currently only 6% of the mental health budget is spent on children and young people, and of course you've got 50% of mental health difficulties arising before the age of 15, or I'll have to double check that, but yeah, it's about that. And young people are 25% of the population. So is there something you could do around there and kind of advise local authorities?
Our relationship with local authorities is less direct than that, but one of the things that NHS England is doing is preparing guidance at the moment, which will go out to through the clinical commissioning groups, but will be shared with local authorities who will need to be partners in the transformation plan process. So that guidance is being prepared in partnership with the DFE and with the local government association and other partners who have influence with local authorities. So the guidance should reflect our desire to see greater partnership at local level to transform things on the ground. But partnership is key, and responding to local need is key.
Could I just tackle the arithmetical point you make? It's tempting, and statistics being as they are, any campaigning group will produce the statistic that indicates that percentage-wise, whatever it is that's coming their way, if you look at it their way, it isn't quite sufficient. But you can't actually carve up all the budgets that way, because you could take either another individual condition or another age group and their tendency to particular illnesses and say, well, look at what small percentage is being spent on that. You can't quite carve it up in that sense. But again, your point and the committee's overall point, which brings us all here, is one which is not denied by government, and that is that in the determination to improve the country's general mental health, the effort put into children's mental health services has been deficient. You're perfectly correct in your understanding that early intervention makes a difference to adult mental health conditions, and it's because of that that the leveraging up job is being done. But it won't be done overnight. It takes time. It's done in conjunction with the other things that people want to see changed around people's health and the like. But that's the determination. That's what we're building towards.
Thank you very much.
You're
but
welcome.
I'd just like to say I just want to say for the record that those statistics were taken from the Future in Mind report.
Yes, we know them.
Thank you. Sophie?
Hi, I'm Sophie. I have two questions. We fear that money is not always used effectively, and that agencies may choose to protect their own budgets rather than work together. What action can you take when service providers do not use money effectively and choose to problem dump rather than cooperate?
You want me again?
Yeah.
All right. Okay. I've been introduced while I've been doing this job to a phrase that I'm sure you will have come across a number of times, the so-called perverse incentive. That means that because of the way in which we pay for different services around the country, and because local authorities have budgets, CCGs have budgets, NHS England has budgets, etc., the way in which an individual might travel through the system means that their expenditure on them will not always come from the one pot. I have to tell you, life being what it is, people look to protect their own budgets, and if some other budget can handle somebody else's care, then it's not unnatural that people may suggest that this is the better way forward. I don't think it's the best way forward. What the system has to do is recognise that the journey of the patient is about the patient for the convenience and the improvement of health of the patient, not for the system. And one of the things that has come out of the discussion that the report and the Future in Mind document looked at was this tier system and the perverse incentives there that rather got in the way, as you said, of a clear intention to improve things because the system became rather more important than the actual care. We're hoping that, as Flora has mentioned, the local transformation plans, as well as the work that's going on in other parts of government to integrate better health expenditure, to make sure we knock out these perverse incentives, will make sure that, firstly, there aren't incentives for someone not to do something because somebody else ought to pick up the bill, and it might help also to deal with the variability in practice that we've seen. So we're aware of the danger, and I think that local transformation plans can start to make a difference to that, as well as are looking quite hard at whether the tier system should stay in place, whether it's had its day, or how to revise it in some manner.
Perhaps I could add something, specifically an example of joining up between schools and health services. I'm Anne Gross from Department for Education and Director responsible for various parts of children's policy, including our interest in children's and young people's mental health. So one of the things we are working on jointly with the Department of Health and NHS England are some pilots in 15 local areas which are about training people in schools jointly with clinical mental health specialists so that there's a better join up. The aim is to see if we can develop a system where you have a lead in a school working with the lead in CAMS so that there's a better coordination, CAMS people are able to train people in schools, that there's a two-way dialogue. And we think by that sort of work is a better way of promoting good use of resource. So it's about trying to develop partnerships and develop good ways of working, which I think is probably just as effective, if not more effective, than stepping in when things go wrong.
The second part of the question is about a visit to a CAMS centre yesterday. The service providers told us that they preferred local budgets instead of national budgets as they provide a more effective service. Do you agree with this, and do you think this is realistic?
Yeah, I'm just getting into all this in budgets, so you'll forgive me. I'm slightly cautious about this. I've already said I'm very interested in how the budget processes currently work, because the importance for all of us as politicians and all of you as representatives is to make sure that finance is used remembering the proper aim of it, which is, in the case of health, to provide the right treatment, and that things that are barriers to that, whether it's budgetary headings or the like, should be dealt with. The central point that the more local it is, the better, is one we certainly agree with. There are certain specialised services that are, however, always provided from the centre. I know that in relation to the bed issue, for example, there are certain key specialised services that a local area can't be expected to finance itself, and therefore there will be help from a central funding like NHS England to cover something like that. But it should be seen as a seamless partnership rather than a barrier to getting the right treatment. But in general, the point about local provision and local budgeting as the better thing to do is one that we would agree with.
Good afternoon, my name is Francesca. So for many young people with mental health problems, GPs will be their first point of contact. So we've been told that young people's experiences of going to their GP are variable, and in some cases so bad that they stop seeking support. So what do you think GPs should be doing to support young people who come to them about their mental health? Minister Burt?
Again, this comes under the general heading once more of variability of service. I'm very conscious that there are some GPs who are very clued up onto this. I've already met I've met parents who've had both experiences, those of GPs who've known exactly where to signpost and those of GPs where that signposting hasn't been available, and it's taken a long time for a mother to get a child properly seen to and assessed because of this. A couple of things are very much worth mentioning. Firstly, we're working with the general practitioners' representative bodies, such as the Royal College, in order to make sure there's greater awareness. Secondly, the work that's all being done on parity of esteem and anti-stigmatisation, for example, is also having an effect on awareness. But we're interested in training. I was speaking just 2 days ago to the Royal College of Psychiatrists' annual gathering, in which I was made aware that they have got an increased number of young doctors in their training programmes to be doing a stint with psychiatry. Now, although that's not immediately a parallel, it's an important. It's sufficiently close to give the sense that as more young doctors are aware of what is needed in terms of psychological and psychiatric treatment, this is reflected in their recognition that it's needed at the earliest possible stage. So it is certainly something that we're very keen to encourage GP practices to do. We'll be having a lot of contact with them, but that general awareness, I quite agree, is a key part of making sure that people start absolutely as quickly as possible. But the growing awareness of this whole area, the recognition of as Rowan was quoting, the recognition of the need for early intervention. This is not a little piece of knowledge just held by a small number of people now. It's out there. I expect a profession like general practitioners are well onto this, and that variation in understanding we ought to see eliminated over a period of time.
Thank you.
Thank you. Saskia?
Hi, I'm Saskia. Thank you for coming to speak with us this afternoon. Following on from Francesca's question about GPs, just in a bit more detail, I was just wondering, Minister Burt, if you could start with this one, please. What guidance is currently given to GPs on detecting the signs and symptoms of mental illness in young people, and how are they kind of educated on how to make young people feel welcome and supported?
I don't know.
I think there's a long way to go on that, and we probably should write to you and let you know what the arrangements are. What we're very keen to do is we have something called Your Welcome Standards, and this is about how, for example, general practice engage with children and young people to make them feel welcome. So we certainly want, from the perspective of the Department of Health, and these standards are owned by us and by Public Health England, to make general practice aware of them and actually implement them. And I think the other route that we could consider is what the Care Quality Commission could be doing as they inspect general practice, to think about how what is the perception of children and young people, particularly when they have a mental health issue, and coming into the practice, and how that could be supported. So these are just two areas, but in terms of the general approach to GP training, I think we would need to take some advice and write to you about that.
I don't think it's necessarily been the role of the department to issue guidance in such a manner as you describe. I think that tends to come through the education and training which they get in any case, what the Royal Colleges may say to them, and any specific extra guidance related to things that come up where they need something new. But in terms of the variability of experience of patients with GPs, this is something we need to look at. So I will find out what there is that's already done and see whether that constitutes something that we could do further. You may want to consider it as one of the recommendations that you make, bearing in mind the initial contact of most young people with any health concern, or parents or carers on their behalf, is with the GPs. If you think this is an area that you think could be improved better, then you might make a recommendation that better guidance is available for GPs. I don't know whether you've interviewed any specifically on the training or guidance that they've had, but certainly this is an area that you could consider, and we would be quite interested in seeing it in your recommendations.
Okay, thank you.
To Select Committee. For this area, we are focused on education mainly, but feel free to comment on it whenever you like.
I think it's time for my colleague to...
So, as we know, in the November 2014, the government announced that there'll be a new guidance with PSHE Association. There's obviously evidence-based counselling strategy, and also there's Ofsted inspection framework. Now the question is basically, the government policy is saying that PSHE should remain optional. But as we earlier we interviewed other school nurses and other students, 90% of teachers believe that training should be made should be compulsory, coming from Public Health Association. So my question to hopefully Minister Gyimah is, why has the government decided that it should remain non-compulsory, and from what age do you think that the students should be educated about mental health? As I said, I'll be targeting the Education Minister, but feel free to comment on that. Thank you.
It's a very good question, and thank you very much. We've made clear in the introduction framework to the new national curriculum that all schools, primary and secondary, should teach PSHE. But they should be free to teach it in the way that is appropriate for their pupils. And we've outlined this expectation in the introduction to the new national curriculum. I think what is important here is the quality of the teaching, which is why we funded the PSHE Association to develop the guidance, but also the lesson plans. We do want, and actually the question I'm often asked is not just about PSHE, but also SRE lessons, sex and relationship education. Often people want both to be made such. And I think we, on all young people, what I would say is to be prepared for adult life, and taking this seriously is very much a part of that. And I agree with the committee that high quality PSHE is important, has a vital role therefore to play. But I think the important thing is the quality of what is taught, rather than sort of making it statutory. We want to allow schools to do it in the way that works best for them.
Thank you. Saskia?
There are lots of, just following on from what Peggy said, there's lots of standards and targets for schools to achieve regarding young people's physical health and physical education. Why is there not the same set out for mental health and mental education? Would you like to?
Again, another good question. Ofsted does look at a school and what a school does around mental health education in its judgment. So it is reflected in the accountability system that we have for schools. I think it is important, as I've said already, that in PSHE it is reflected there. But also school counselling, I think where we've tried to focus at the moment are the practical things we can do to make sure that where young people are at risk or actually begin to experience mental health problems, that the practical help is there. And we issued guidance on school counselling last year in terms of how schools can do it better. There are some schools that do it very well, and it's amazing the effect it can have. I was at Elizabeth Gareth Anderson School in Islington earlier this year, and how firstly there's no stigma associated with it. Young people felt very free and able to go and see the school counsellor. It was seen as very much like going to see the school nurse. And I think for me, getting those things right now is where the priority is. But of course, we know that schools do what is measured, which is what your question is driving at. And at the moment, it is reflected in the Ofsted judgment of schools. I don't know whether, Anne, you want to add anything to that?
Yes, so I think Ofsted are really aware that good schools have a really strong understanding that mental health and good mental health and well-being and resilience is very much linked to children and pupils' academic attainment. So students do better if they have good mental health and well-being, and I think that that's widely understood. And the recent Ofsted framework has a stronger emphasis on those issues, and it includes what's called a grade descriptor for outstanding schools, which says, and I'll read this out, it says that pupils, in order to be an outstanding school, there needs to be evidence that pupils make informed choices about healthy eating, fitness, and their emotional and mental well-being. So that's quite an important reference, I think, and shows that it's really embedded in being a good school.
Can I just add one thing? I went to the Maudsley about 3 or 4 weeks ago, and I saw one of the pieces of work which they did in schools, and this was appropriate to primary schools. They take in just a one morning course to talk to primary school children about mental health and its importance, where in very simple terms they address the sort of issues that children might be seeing amongst their friends, to give them the sense that just as a child may fall down and hurt itself in one way and be hurt and visibly hurt, sometimes children are hurt in a way that they can't quite see. And they explained it extremely well, and they said the children were really, really energised. And we saw film, they'd taken a DVD of them doing this work and the children's reaction and what they said about the course afterwards. Really interesting. So some of that work, I think, in schools also helps. It's the destigmatisation, but schools that do this might be recognised for doing this sort of work.
And I think we're really aware that raising awareness and understanding of the importance of mental health and well-being is important for children at all ages.
Yes.
Obviously for very young children, that's about helping them understand emotions and talk about their feelings. So talking in quite simple but very important and practical ways. As young people get older, there may be a need to for schools and teachers to be confident about helping young people talk about particular conditions, eating disorders or self-harm, for example. So giving teachers support in feeling confident to do that. And that's some of the work that we've been doing through the PSHE Association in developing lesson plans. We hope to be publishing those quite soon. And we actually have been piloting them in, I see Laura's from Shropshire, and we've been doing some of that work in Shropshire with quite a lot of schools involved, getting a very positive response. So, those are some of the sort of practical things that we want to do to help schools gain confidence in working in these sorts of areas, as well as some of the things we're doing to involve young people, because we think there's a really important, we can say a bit more about that if you like, but a really important role for young people as in supporting their peers, and a role for young people as peer counsellors.
Thank you. Laura?
Good afternoon, I'm Laura. During a private evidence session with young people with mental health issues and a committee visit to a CAM centre yesterday, the committee was told that exam pressure is having a huge impact on young people's mental health, and that schools are not helping pupils to cope with the stress and anxiety this causes. In written evidence, one boy said that exam stress triggered his anxiety disorder, and he had to receive treatment through a youth charity. There was simply no support in school for him. So my question to you is, how will the government ensure schools offer support to pupils leading up to and during the exam period? And should this support be the responsibility of the schools in the first place? So, Minister Gyimah, would you like to begin?
Again, a very good question. And I'm glad you framed it the way you did, which is talking about support rather than there's exam stress, so let's get rid of exams, which is how someone else could have approached the question. And yes, one part of what we aim to do in the Department for Education is make exams rigorous, to raise the standards within our schools so that pupils leaving school are well equipped and well prepared for life in modern Britain. We have, in line of that, we're championing the EBAC, which is a requirement for schools. Now, we know that there are a small minority of pupils for whom EBAC would not be appropriate, and we need to look at what support that they need. But then there are, for the vast majority of pupils who are taking the EBAC and have to go through those exams, we do need to look at the right sort of support. And I think there are two types of support we need to look at. One of it is to do with the teaching and the quality of teaching and helping teachers prepare pupils in a way that ameliorates the stress rather than increases it. But the other is, going back to my earlier point, having good quality school counselling available on site. And my experience so far is that the quality of school counselling is highly variable, and I think we need to do some work in sort of what good looks like, and we need to find a way of embedding that good practice within all schools, so that whether it's exam stress or whatever other stress, and in some cases it's stress in the family that makes it difficult for pupils to perform at school, that there is someone on site who can help them with that.
Thank you.
Thank you. Ryan?
Hello, I'm Ryan. Minister Gyimah, all school staff have to undergo child protection training in schools, but in the Future in Mind report you said not every adult who works with children and young people can be a mental health expert. Do you believe that teachers should receive mandatory training on mental health as they do child protection?
Well, teachers are not mental health professionals, and mental health is an incredibly complex area. But one thing that teachers do though is they can identify when there are changes in behaviour. You've got a class of 30, you get to know them quite intimately, and you notice when someone is suddenly not eating, or when someone is close to a particular friend and are no longer associated with that group. So teachers are in a very privileged position to notice some of the changes triggered by mental health issues or lack of well-being, but we shouldn't expect them to do the job of mental health professionals, I don't think. I think what you need the right professionals, whether it's pastoral support, but certainly counselling services in the school, so teachers can help refer those children to those services rather than the physics or maths teacher having to double up as a counsellor. But also it may be that the children may not want to actually discuss that with the teacher in the same way as they might not want to discuss it with the parents. I think independence is also important, and that is another reason why I wouldn't expect teachers to perform this role.
If I might add, that the pilots I mentioned earlier, which are about joint training between schools and children's mental health services, are really intended to help build awareness and confidence in schools, and make sure that if if teachers are aware that they've got young people who are experiencing difficulties, they know who to refer on to. So that's a system that we're really interested in developing. And of course, in schools, you have special arrangements for children with special educational needs, and you have a SENCO, a special educational needs coordinator, who has a role for that group of young people. The Special Educational Needs Code of Practice has introduced a type of special needs, both social, emotional and mental health needs, which is all about understanding where, if pupils aren't making good progress, it's understanding the impact of mental health needs on their progress. So there are people in schools who do have an understanding and can help with those issues already.
I think it's a further point to make. Continuing professional education and continuing professional development now matters in virtually every profession you can mention, and people go online and find more online resources to help them in relation to this. There's one particular resource the committee may be interested in, that's one called MindEd, which is a free online resource available for teachers and others working with children and young people, including doctors and nurses, to provide educational information on signs, symptoms and suggestions on how to identify, address and support children and young people with mental health issues. That sort of resource is also helping to make sure that those who are looking for extra support and things that will assist them in doing the work, whether they're in a purely educational setting, whether they are those who are with any of the uniformed organisations in a position of care and responsibility, that they're also able to spot things. And I think it's a beneficial use of what can be provided these days through modern educational methods that will help all of us.
Thank you. Leanne?
The committee has heard from the University Mental Health Advisors Network, Dan Duran, and he stated that along the lines of that the Department of Education guidance states that you need to have a whole school approach to mental health, and within higher education, I think there needs to be a whole university approach to mental health. Dan Duran from the University Mental Health Advisors Network has praised the guidance from the Department of Education on mental health and behaviour in schools, particularly in relation to the whole school approach. Could the Department for Education work with the Department for Business, Innovation and Skills to issue similar advice and guidance for universities?
It's again a good question, and I hope that appearing here with my opposite number at Department for Health demonstrate that in the first instance we understand that dealing with this problem is one that you need to do at a cross-governmental level, and it's one that has support at the very highest levels of the government. That said, it's worth bearing in mind that higher education institutions are autonomous bodies and they're independent from the government. They have legal responsibilities under the Equalities Act 2010 to support students, including those with mental health conditions. So it's for the Higher Education Institute to determine what welfare and counselling services they need to provide to their students to offer that support. And I would hope, given how important this is, that higher education institutions look at what is happening in schools and take note and actually make sure that they do their bit, because it is just as important to deal with this in higher education institutions as it is in primary and secondary, as I've outlined earlier.
Thank you. Gyimah?
Okay. Evidence submitted to this committee suggests that whilst there is good information on mental health available online, young people and professionals do not always know and often cannot find sites that they can trust. One teacher described it as a bit of a minefield. The solution proposed by the Future in Mind report suggested a kite marking system that would separate the safe and accurate sites from the others. My question to Minister Burt would be, what plans does the government have to help young people and those who work with young people find trusted and appropriate information online?
I think our first port of call is the UK Council for Child Internet Safety, which is a group of more than 200 organisations drawn from government, industry, law, academia, charity sectors that work in partnership to keep children safe online. They produce guidance documents for industry, including on social networking, moderating, safe searching and chatting, and chat and advice for industry on effective internet safety measures, including things like taking people who may go to one website with advice for them, particularly youngsters who may research something like suicide, for example, to take them to a place of, do you want to talk about this, etc., etc. I think this is it's a genuinely tricky area. The risks and the dangers are huge. Again, it's something I'm sure your committee's considered about the availability of the right sort of apps that might, take people in the right direction. What new may be produced. I don't think anybody's information at the moment on this is in any way perfect. We're very conscious of the existence of some sites that may celebrate eating disorders, for example, and how people who may go into those could be led away from those into something better. The risk of something turning up which is even worse is always there, and some of the sites are truly very bad and very dangerous. So it is a serious priority for all of us in government to work right across the government network and with charities and others to say what can we do, and to work with the industry to try and find a way either of ensuring that the worst of the websites aren't there if they fall foul of the law, but those that just keep themselves inside the law, what can be done to move people into a safer area, a safer direction, and how to protect people who may have accessed such sites. It's an ongoing process, but again, I suspect you will, and I hope you might have something to say about this in your report, because we'll be very interested to see that. Thank you.
I think you've touched on a big issue here, which is how use of social media in this space actually in some cases causes harm, but actually in other cases can be used to combat the very harm that it's created. And I think that one of the things we can do, and that we are doing, is to empower young people. And the kite mark is one suggestion, but for example, what we're doing in online safety, we've got new computing programs now introduced in September 2014 to ensure that e-safety is taught at all for key stages, I think is incredibly helpful to young people to identify what is a site that you shouldn't be trusting versus a site that you should be trusting. Just to give you a little bit more detail on that, it covers responsible and respectful and secure use of technology, as well as ensuring that all pupils are taught age-appropriate ways of reporting any concerns they may have about what they see or encounter online. So this is not the kite mark idea which you were sort of probing about, but I think what this is doing is actually giving young people the knowledge and understanding online to use online to make sure that they can actually make some of these judgments themselves as well.
Thank you.
Could I just raise one more, if I may? I want to talk about the Buddy app. I don't know whether you've come across this. This is a digital tool to support therapy services. Clients use text messaging to keep a daily diary of what they're doing and how they're feeling, which helps the reinforcement of positive behaviours and keep appointments. So there's an example of a mobile application that's having a beneficial effect, and you may have thoughts about how further these could be developed. Again, if I can just say in passing, this is one of the areas where I think those of us who are parents, and indeed some of us who are grandparents, are aware that our childhood was very different to that of others now. In principally, when you went home was a place of safety. You couldn't necessarily be chased there if things had been difficult at school. Now, of course, you can be, and through cyberbullying and things like that. This is a pressure we didn't have. And it must be a real worry to you, and it's shared by us. And the impact on young people's anxiety and worries and everything else can't be overstated.
We only have a few more questions left, but is it okay if the panellists, if we run a few minutes over?
Fine.
Is that fine? That's great, thank you. A lot of evidence that has been submitted to us is from young people who do not know where to go when they have a mental health issue, nor do they know where to get the information. The Future in Mind report said, young people and their parents need clearer awareness of how to recognise when they might have a mental health problem, as well as where and how to get help. What plans does the government have to respond to this? I'd like to ask you, Minister Burt.
I think Future in Mind highlighted a number of issues with difficulty of people accessing services through the pathway, from the detection of symptoms to assessment to receiving treatment. We're very hopeful that the findings of that work, which was compiled with so many people involved, and the way in which we're processing this and the development of local transformation plans will have an impact on this. It goes back to something we were talking about earlier, the provision of information for GPs, for example, and in GP surgeries. It's a constant process of increasing awareness and the like. So we're quite sure that some of the recommendations being made in Future in Mind, which we're developing, are going to address these things. So it's out there and we're doing it.
Thank you.
I mean, the comment I would add there is one of the key ways of making sure that young people can access these services and these services improve in a way that works for them is to include them in the service design. It's all well and good for people in Westminster and so-called experts to try to dictate how these things are done, but I think one of the key principles that we use to apply, one of the key principles that we used in our special education needs reforms was to involve young people, and that required engagement, including setting up a clear and transparent local offer. And I think we can learn a lot from how those services were redesigned and how we look at designing services here to make sure that young people can actually access the services at a place that is appropriate and that works best for them.
Thank you. Francesca?
Thank you. Mr. Gyimah, earlier you mentioned the benefits of social media and in particular apps in supporting young people with poor mental health. Just expanding on that, we've been told that young people would like to have informative and youth-friendly apps on mental health that have been quality assured. What will the government do to make these apps like this available to young people?
Well, I mean, in terms of making apps available, there are a lot of apps out there, some for good and others are for ill. I personally think the government shouldn't be in the process of developing more apps for the market, but actually helping identify the ones that work and helping make sure that for the ones that are a useful resource, that young people are directed to them. And I think that's certainly one of the things that we can look at as we go through this process of sort of awareness destigmatization of our mental health issues, to make sure that the online resources are available to them, because actually for a lot of people who suffer and who sadly suffer in silence, a lot of it is happening online. So it's a place where we do need to be to make sure that children do not suffer in silence.
Through some of our voluntary sector projects that we're funding this year, we are putting some money into developing apps. For example, there's something called Silent Secret that we're funding, which is about developing a platform for young people to share their thoughts. And I guess we'd actually also be rather interested in your views in this area. What do you think would work? What would be most useful? It's something that I think would be good to hear from you on.
It's like asking me to sort of produce the next number one. I'm not going to do this, but you are, sort of thing. So
you are.
Well, I'd like to sing the B-side of my latest single, but that shows how old I am. It's that I think it's a combination of resource here. The best these days, the ability to bring forward ideas, it's never been easier. If you want to publish something, you can anywhere, and young people's culture in terms of music and arts and everything is illustrated by people who've just taken the chance, the vloggers and people like that, being able to get out there in a way that never would have happened in a previous generation. Now the same is true with ideas for things that are affecting you, particularly in something like mental health. The best ideas will come through a combination of what you're doing yourselves, working with the various charities involved, looking at other professionals who also spend their lives working in these areas. But I suspect some of the best ideas really will be absolutely street level and taken through, because the ability to find the right thing and then suddenly millions of people are just zeroing in on it because it's good. That's still likely. The best apps will probably come out of the most surprising sources, I would have suspected.
Thank you. Terence?
Hi, my question is, we note and welcome the recommendation by the Future in Mind report for a hard-hitting anti-stigma campaign. What specific action will the government take to involve young people in building this campaign? Hopefully we can start off with Minister Gyimah and welcome on to Minister Burt.
Great. Well, anti-stigma is and dealing with it is absolutely critical to our efforts to tackle mental health for young people. And we've got a range of things we are looking at. For example, we've seen the Time to Change campaign and how well that did. I think that's something that we can use turn around for young people. But also, I think within schools, as I touched on earlier, removing the stigma around going to access support and service if you are suffering from a mental health problem. I think that is absolutely key, and that is what the whole school approach is about, that if it's embedded within a school and it's totally normal, then actually people don't feel there is a problem. As I think Alistair used an example saying, I've got an issue in this way and this is what it's making me feel, I am going to see someone about it. And I think that whole school approach is central to dealing with stigma within the school system for young people.
We know that organisations and partnerships such as Young Minds, Time to Change, as mentioned by the Minister, Mind, Head Start and many others, are doing local work within schools, educational settings and online to address stigma head-on by appointing their own champions to talk about mental health issues and encouraging others to do the same. Zoella talks about her experience as a Mind Ambassador, for example. We are currently considering how we might develop a national social marketing campaign with a mechanism for dialogue. So it's a genuine two-way conversation driven as much by young people themselves and carers as by anyone else. So I think the efforts that have been made in combating stigmatisation over recent years have been quite successful in other areas of mental health. We have to keep the progress going, look for new ways to doing it, but you're right, this is an area where developments are likely and necessary, and we share your ambition for this, and we're certainly going to continue with our determined efforts to do all we can to combat it.
I also think this is an area where we've got to be open-minded in terms of what would work, and one of the things that I've been very keen on since taking on this role is that we don't appear to think we know all the answers within government. And your recommendations in terms of what could be done and what is, and I would say by all means don't be bound by the Future in Mind report. If there are things that the Future in Mind report didn't cover that you think it should have, by all means let us know, because that's how we're going to make progress.
Thank you. First of all, I've noticed that you're both ministers from different departments. Do you plan to collaborate together in future, especially on the topic of mental health and how it can be improved, and improving communications between different secretaries of state?
Yeah, well, if I can answer part of it for both of us, I suspect we'll be seeing too much of each other as far as this subject is concerned. We've already got events planned in the diary, roundtables planned through to October that both DFE and DH, Department for Education and Department for Health, are working on together, and we do recognise and acknowledge that that is the way to make progress here, and we are as one in terms of not just the mission but how to get there.
Yeah, it's very easy. The process of government, whether it's local government or anything else, silos appear very easily, as you're incredibly aware, I'm sure. Our departments have their different responsibilities, but the process of politics means that at the level at which we operate as ministers, it is very easy for us to get together. It's very easy for us to bring our respective secretaries of state together if we needed to, and we don't, because they share the same ambition. As an example, I was just stopped in the lobby of the House of Commons just last week by Nicky Morgan, who just wanted to raise something about something we were talking about. She, as Secretary of State, just had a brief word with me. I think as politicians respond to the things that the public bring to us as problems in politics. Why do you people always do X, Y, and Z? One of them has often been, why do you seem to operate in the silos that you do? Why are these perverse incentives in funding, for example, stopping people doing things? And remember, we start as people like yourselves, we start as representatives, we start as grassroots activists, asking exactly the same questions as you, and we're not, we don't belong to the administration of our departments. We are in a different position. So we ought to be able to respond to that concern of the public by saying, what can we clear away if things are getting in the way of things? Now, processes have their purposes. They make sure that the whole business of government isn't just an arbitrary lottery, and processes are important. But where they do get in the way of things, you are quite right to say what can be done to break them down, and relationships between ministers, making sure there's no jealousies between departments, making sure that something isn't done to the disadvantage of another. We're the sort of people who ought to be able to do that, and we've picked it up, we've recognised it. We will do our best in this government to deliver on that, and that's right from this department right across all our other partners in dealing with things like mental health.
That's very useful, thank you. Is there anything else either of the ministers would like to add?
I just had one, if I may, and that was we thought through a little bit on your recommendations, and just to suggest one or two things that we would be very interested to see from you that would help us in our deliberations. Firstly, your views on Future in Mind and how we implement the proposals. Secondly, your recommendations on how we can keep children and young people safe on the internet, as we've just discussed, and your ideas for future digital apps that give us a credit and a percentage if you come up with anything really good. How we can improve participation by children and young people in policy making and in planning for implementation, and your suggestions to answer this question, which actually Minister Gyimah raised with me last week when we sat together. What do good services look like? What does good look like to a parent in distress, a carer in distress, a youngster in distress? What is it they really want to see from your point of view? And to go back to the question that was asked earlier, how do we make sure that decisions are not made that suit the system rather than the individual? I know that's very idealistic, and I recognise that it won't always be like this, but how can you help in that process to make sure that we focus on what it is you think that you and friends need, to make sure that we've got that at our forefront? if you've got stuff like that in the report, I think we'd all find that really helpful.
That's great, thank you.
I agree with all. And the only thing I would add is peer-to-peer support. We've discussed so far what can be done at an institutional level. So what happens within schools, what happens in terms of services. There is some peer mentoring there, I am aware, but I think we can do a lot more around peer-to-peer support, because often, whether it's bullying, we didn't touch on bullying today, or some of the things that cause these things in the first place, young people are there and they see it happening to their friends. So what can we do on a big scale to actually get peer-to-peer support working as part of our response to dealing with young people's mental health issues?
Thank you. Just to inform you that this is our last oral evidence session, so now we'll begin finalising and creating our report, and it should be released by November, and we do look forward to presenting it to you. But with that, I close the 6th and final panel of the day and our last oral session, and again, thank you ever so much for joining us and giving your time. Thank you.
Thank you all.
Thank you very much. Thank you.